I don't know, I'll ride up and down the state screaming, the taxes are coming, the taxes are coming.
Governor Romney was the author of Romney Care, which is a top-down, government-run healthcare system which, read an article today, has 15 different items directly in common with Obamacare. Everything.
The system that we put in place in our state was something we worked out with the labor community, the healthcare community, business, and the citizens of the nation. We came together. It was voted by a 200-person legislature. Only 2 voted no. Our system has a lot of flaws, a lot of things I do differently, has a lot of benefits. The people of the state like it by about 3 to 1. We consider it very different than Obamacare. If I were president, day one, I will take action to repeal Obamacare. It's bad medicine, it's bad economy, I'll repeal it. And I believe the people of each state should be able to craft programs that they feel are best for their people. I think ours is working pretty well. If I were governor, it would work a heck of a lot better.
All right.
How much is that going to cost? We thought, we didn't know the answer. We had some folks at MIT come in and build a model and look at it. We thought if it comes back $3 billion, why, we know we can't get there. They came back and said about $600 million. I said, you're kidding. I mean, we could actually save.
From Boston. Governor, the money shot for me is Ted Kennedy behind you. What do you make of that?
Well, it was a bit of a shock, as one of my sons said. Ted Kennedy supporting a bill which I authored. That's going to actually be a cure to global warming because hell is frozen over. Well, first of all, let me note that most of the good ideas of the rest of the states we've tried to beg, borrow, and steal in putting our own plan together. We've gone all over and tried to gather from them. What I have not done is said, okay, how can I solve the problem of the uninsured in Texas or in Illinois? We've only focused on our own state and what works in Massachusetts. So I can't tell you exactly how this plan would work in other states.
Unlike Democratic proposals that would give Americans the choice of joining a government-run health care plan, Massachusetts has no public option. Instead, people in the state are mandated to buy private insurance.
Socialism. We don't coexist with socialism. You are very proud of the health care program that you put in Massachusetts because you got it done. However, there are a lot of conservatives that look at that and say, but, okay, it's not total socialism, but it's the road. I want a guy who doesn't compromise with socialism and puts it all in the private sector. Explain.
Well, Glenn, actually what we have right now is the road to socialism. What we have right now in health care is creeping socialism with more and more people going on Medicaid and Medicare, and those who don't have insurance, when they show up at the hospital, they get care. They get free care paid for by you and me.
Right.
If that's not a form of socialism, I don't know what is. So my plan did something quite different. It said, you know what? If people can afford to buy insurance, if they can afford to buy insurance, or if they can pay their own way, then they either buy that insurance or pay their own way, but they no longer look to government to hand out free care. And that, in my opinion, is ultimate conservatism. That's why the Heritage Foundation worked with us and was at the celebration of the signing. The Heritage Foundation, as you know, a quintessentially conservative group, recognized that the principles of free enterprise and personal responsibility were at work. And, you know, I'm proud to talk about what we did. We did not need to raise taxes. We did not need to have the government take over health care. Instead, we rely on private market dynamics to get people in our state insured and for individuals to finally take responsibility for some portion of their health care rather than expecting government to give them a free ride.
With regards to our health care plan in my state, it was the court that established the requirements of abortion, not the legislation. There's no mention of in the legislation whatsoever of abortion. But I understand that the senator is going to want to do whatever he can to try and promote his position. That's his right. I'll make sure that people understand my record, and I'll set the record straight.
Liberals look at the challenges in health care and they say, well, the government's got to take over. We're going to have to make sure that we have a single-payer system. One of my favorite lines in this regard was by P.J. O'Rourke. He said, if you think health care is expensive now, wait till it's free.
This whole stream of thought that you began with, which is, oh, will you say anything to get elected? If that were the case, would I still be defending Massachusetts health care? It's by far the biggest challenge I have in the primary race. And if I were willing to say anything to get elected, wouldn't I just say, oh, it was a mistake? Because I've watched other people on the stage, when they talk about their cap and trade policies, they say, oh, that was a mistake. When someone says, oh, I did this ad on global warming, that was a mistake. And so they just dust it aside. And that makes them more attractive in a primary. I'm standing by what I did in Massachusetts. I'm not trying to dust it aside. On the biggest issue that dogs me in the primary campaign, I'm absolutely firm that it was the right thing for our state. I'll defend that, and I understand it has political implications, and if it keeps me from winning a primary, so be it. But that happens to be the truth.